Fat grafting can be one of the most powerful tools we have in facial surgery. It can also be one of the fastest ways to make someone look unnatural. So the difference usually comes down to one rule. Fat grafting is often talked about like it's simple. You just add volume where volume is lost and the face looks younger. In reality, fat grafting is one of the easiest procedures to overdo, especially around the eyes. I love fat grafting when it's done the right way. It's so powerful, and I've spent almost 2 decades in perfecting my work as an oculoplastic surgeon and how I incorporate fat grafting in my blepharoplasty cases. It's important to know when it's overdone, though, the result just doesn't look youthful, it looks off. So before I explain my rule, it's important to understand what fat grafting actually does. So fat is living tissue. When it's transferred successfully, it doesn't just add volume, it integrates. Fat changes how light reflects, so it can improve skin quality. It becomes part of the face. That's what makes it powerful. And that's what also makes it dangerous in the wrong hands. Because once fat integrates, it's not temporary in the way that fillers are. If you add too much, you can't just dissolve and move on. The most common issue I see with fat grafting is chasing volume, trying to fill every hollow, trying to smooth every transition, trying to make the face look full instead of rested. That mindset almost always backfires. Faces don't look young because they're full everywhere. They look young because the volume is in the right places. When fat is used to chase fullness instead of structure, the result is often heavy, puffy, unnatural look over time, especially around the eyes. So here's the rule I follow. I never use fat grafting to chase volume. I use it to restore support. That may sound subtle, but it changes everything. The goal is not to make the area look filled. The goal is to make it look stable. The area around the eye is unforgiving. Let's talk about the midface. Let's talk about the cheek structures. Let's talk about the temples, the subbrow fat areas. These are all areas that have fat compartments that with time thin out and shrink, so that those fat compartments lose their volume. And so these small changes are magnified with time. And when I'm doing a lower lid blepharoplasty with fat repositioning, the fat that I reposition is not able to be repositioned all the way down to the midface or the cheek. There's a limit of how far it goes down. So I integrate fat grafting to those areas to restore structure, improve structure, and secondarily, the volume gets improved because of that. So it's a lot more of a smoother transition between the lower eyelid and orbital rim hollow and the mid-facing cheek area with the fat. And it's important to know that little goes a long way when it comes to fat grafting around the eyelid area. So overfilling the area doesn't mean someone that looks younger, it just makes them look swollen or artificial. And once that happens, correction becomes very difficult. That's why my approach is always conservative, especially around the eyelid area. Fat grafting works best when it's subtle, when it supports the face instead of changing it. That's the rule I follow and the reason I approach it cautiously.